Now, many of you are reaching out to Dr. Mallika Marshall with coronavirus questions. She is a trusted source, and tonight she is here with more answers. And we're going to start, Doctor, with Cindy's question.
Okay.
She wants to know, what is the wait time between the flu shot and a booster?
So this is updated information. So the CDC says you no longer need to wait any time between getting a COVID-19 vaccine and any other vaccines, including the flu shot. You can actually go and get them on the same day. I saw a friend of mine, another doctor, who was getting one in either arm.
Ouch.
I personally would probably get them on the same arm, but you do what you feel comfortable doing, but you can get them on the same arm.
Very efficient. All right, that's good information. Joanne writes, I understand people with underlying conditions can receive a Pfizer booster. What are those underlying conditions?
So some common examples include things like cancer, chronic lung disease, kidney disease, diabetes, obesity, pregnancy, but there are others on the list. So you can actually go to the CDC website to get the full list of conditions they're talking about.
Okay. Diana wonders, if both parents test positive for COVID-19 and their child under 2 tests negative, is it advisable to take the child to the grandparents or great-grandparents' home until the parents recover?
You know, this is an interesting question because there's always a chance that that child could turn positive within 14 days of exposure to COVID. So if there's concern that a grandparent and certainly a great-grandparent could get infected and seriously ill, it's probably better to keep the child with his or her parents, because even if the toddler gets infected and gets sick, they're unlikely to get really sick, whereas someone who is older could get sick even if they're fully vaccinated. So
one of the many dilemmas.
Exactly.
Okay, this question comes from Ron, who's 81 years old and has diabetes. He says he got vaccinated in the spring, but he came down with COVID last month. He wants to know if he still needs to get a booster shot.
That is a good question, Ron. First of all, thank goodness you're doing okay. And chances are you're doing okay because you got vaccinated before you actually got infected. And you probably did develop some immunity after having COVID, but it's unclear how long that immunity will last. And given your age and your underlying diabetes, you would still be at risk if you got COVID again, God forbid. So therefore, you probably should get a booster at some point, but you may be able to wait a little while. So I would talk to your primary care doctor about the timing.
But maybe not with the same urgency.
Exactly.
Okay. Doctor, thank you.
You're welcome.
Dr. Mallika offers her best advice, but as always, consult your personal doctor before you make any decisions about your health. And if you have a question for Dr. Mallika, there are 3 ways to reach her. Email at Mallika, Dr. Mallika at CBS.com, on Twitter at Mallika Marshall, or you can Facebook message her, Dr. Mallika Marshall. David?